Good evening, everybody. Hopefully everybody's been able to log in successfully. It's lovely to have you all with us tonight. And for those of you who don't know, but I'm sure that you all do, I'm Mrs. Norton, Head of Sixth Form here, and this is one of many Insight Intos that we've done over the few years, looking at a range of different careers with our esteemed alumni who are always very welcome when they come back and give these talks for us. So tonight we have a fantastic range of speakers on the topic of medicine, which I know is a very, very popular topic, as are many others for our students. And the first speaker that I'm going to introduce to you in a moment is Leah Bolkova, who was a student here. Actually, I remember her as a student here, so she's currently a medical student at the moment. Following Leah, we will hear from Dr. Melissa Weatherby, and Melissa was also a student here a little bit. She left just before I started, and she's now a qualified doctor, but is doing her first few years of training after having got her medical degree. We're hoping to be then joined by Gazal Hodhodi, who is a registrar in trauma and orthopedic surgery. And finally, last but certainly not least, we are going to welcome the consultant surgeon paediatric specialist in orthopedic surgery, Naomi Davis. So welcome to all of our speakers. It's lovely to have you here. And finally, once we've had all of our medical specialists speaking, well, I'll hand over to Miss Hannon, our head of careers, and she will give you some information about applying and studying for a degree in medicine. So, without further ado, I'm going to hand over now to Leah, and she's going to talk you through her experiences. And I should say that if you do have any questions, that you can write questions in the chat section. And at the end of the evening, if we have time, we are planning to finish at 8 o'clock promptly. I will pull up some of the questions that I think are most relevant to everybody, and if we have time, we'll have whoever is the most appropriate specialist answer our questions. So that's enough from me, and over to Leah.
Hi everyone, so thank you so much for having me. I'm really hoping my Wi-Fi is going to hold out for 20 minutes. So I was just going to start off by telling you a bit about myself and how I ended up where I am. So I left Man High in 2017. For GCSEs, I did triple science and then English maths, as you have to do, further maths, French, RS and food tech. I then did a physics AS and biology, chemistry and RS for A-level. So I really liked this combination, as I thought it kind of gave me the science that I needed for medicine, but still allowed me to do some sort of humanities. I would say that RS A-level for me has been just as useful as doing biology and chemistry. Studying medical ethics at A-level just gave me a really good grounding for what would be covered in medical school on the topic, and it helped me to hone my writing skills, which has definitely come in handy. Also, a lot of medical schools do value variety, as it demonstrates you're an all-rounder with more than just science knowledge. So I'm definitely an advocate for a humanities third option for A-level. So now I'm studying at the University of Bristol. I've done 3 years of medicine, and then now I'm in my 4th year, and as Mrs. Purvis would be probably very pleased to know, I'm intercalating in bioethics, as inspired by my RS A-level. So I thought I'd start off by kind of telling you all about the structure of a medicine course. I didn't really know that before I went to uni, and I thought it would be some useful information to let you know about. So this is what the Bristol course looks like, but it's similar to most medical schools across the country, but there will be a little bit of variation. So 1st year and 2nd year are pre-clinical. 3rd year, 4th year and 5th year are clinical, where you're mainly on hospital placement. And then you can intercalate between after 2nd year, 3rd year or 4th year, again, depending on your uni. And then you sit your finals either in 4th year or in 5th year, again, depending on the university. Please have the next slide, Lex. Okay, so in 1st and 2nd year, they were preclinical. So here we did integrated learning. So that means it's mainly lectures, seminars, tutorials and labs with placement every few weeks. So it's mainly theory learning, and then every few weeks you'll be in hospital or GP, so you'll be able to consolidate this learning with a little bit of patient contact. So this patient contact's quite good because it's like slowly introduces you to the world of medicine and allows you to develop your skills with patients in taking histories and doing examinations, etc. So some medical schools are more traditional, so like Oxbridge mainly do lectures and you don't have much clinical placement. Others are more integrated like Bristol, and our style of learning is case-based learning. So we have lectures and tutorials where we discuss cases. Next slide, please. So here's an example of a typical week I would have had in first year. So it's quite busy, lectures, tutorials, got some anatomy sessions there, but not too 9 to 5. I remember being surprised, for me personally, it wasn't 9 to 5 every day, and there was time in your day to do other things. Please can I have my next slide? So in clinical years, I was in hospital full time, and I think that's the same for lots of medical schools across the country. This is really where you're able to put your skills into practice. So you do have some tutorials and teachings, but for the most part, you're sort of left on your own to go and interact with patients. So you normally have some sort of checklist, which is quite long, of various tasks that you need to complete or things that you need to attend, or various things like that. So for example, that could be take a history and examine a patient who presented with cardiac pain or with chest pain, sorry, or attend a cardiology clinic. So you sort of throughout the year, you spend your spare time when you're not in teaching, just going through that list and spending as much time on the wards as possible. Next slide. And so this year I am intercalating. So that's where you sandwich a separate degree in the middle of your medical one. So you can do a BSc or a master's, and there are plenty of options. So at Bristol here, they offer like genomics, childhood studies, pharmacology, neuroscience, and bioethics, which is what I'm doing. And all the universities will have their different array of options. And you can also choose to study at a different university if you would so like. Next slide, please. Ooh. Oh, okay. So this is my week this week, which is stark contrast to first year. As you can see today, I've had a very busy day of nothing. It's much fewer hours compared to medicine, but this time is mainly spent doing readings and pre-work for the various sessions. And it is a new style of learning, which I have had to get used to, much more reading than I would have had to do previously. So I would highly recommend intercalating if that is something that interests you. For the very short while I have been doing it, I found it really, really interesting. And it's just nice to do something different for a year and expand your knowledge in a specific field. So I would recommend that. Also at uni, there is a lot of extracurriculars you can take part in, if that's something you're interested in as well. So I've attended quite a few different societies last year, some with more longevity than others. So you obviously have all the sports. I did mixed lacrosse for a while, admittedly not very well. Then you tend to have a wide variety of societies, some being quite niche. So for example, I've also taken part in the Cheese Society, which admittedly did last longer than the lacrosse. And then you also have your medical societies that you can take part in. So each speciality tends to have a society for them, where talks and skills sessions are put on for you to take part in. So I've attended obs and gynae talks and surgery skills. And I also take part in basic life saving, where I teach first years CPR so that they can get their qualification. And if there's hundreds of societies at every uni, and if none of them take your fancy, then you could just set up one of your own. So please have the next slide. So seeing as I can't really talk about what medicine's like after uni, I thought I'd share a few of my tips for applying. I know that some of you will have already applied this year and some will be applying in the future, but I've tried to cover all the aspects of the process, and so hopefully this will be helpful. I couldn't quite remember all the ins and outs of applying, so have asked around lots of medics and tried to gather these, so hopefully they are reliable. So firstly, before applying, I think it's really important to look at the specific uni course websites, really go through these and write down all the important things. So lots of uni websites give help for your personal statement and for interviews, and they highlight the various things that they're looking for specifically, which would be helpful for you to include in your application. And that means that you can target your application so that it's specific to the 4 unis that you're applying. Also, it's important to look at how the course is structured, if it's traditional, case-based or problem-based, is anatomy prosection or dissection, can you intercalate, and what do they offer? And you need to think about what would best suit you and what would you prefer doing, because that should influence where you apply. And I think it's important to keep that in mind the whole way through your application and your interview, so that you can direct your whole application towards the specific unis that you are applying for. Then next, it's experience and volunteering. So it's just important to get as much as possible. This doesn't necessarily need to be inherently medical. Any sort of experience that broadens your understanding and helps you to know what a career in medicine entails is very good. So it's important to reflect on these experiences in your personal statement and in your interview, because they don't want just a list of experiences. They want to know the skills that you've developed, what you've learned, and how they made you feel. It's also good to demonstrate further research building on those experiences to show how you've actively engaged with them as well. So for the UK CAT and BMAT, or I think it's called UCAT now. It was UK CAT when I did it. But those, I'm sure some of you have already sat it this year or are planning on sitting it this year. And it's hard to offer more advice really than to practice as much as you can. But I think it's important to really work on your timings, especially for the UK CAT. It's all about the timings there really. And use the past papers and resources that are available to you. Online there are so many and it is endless, so do have a look there. I just think even familiarising yourself with the structure of the exam is very helpful, and that will just definitely improve your confidence. Even just doing a few practice papers will set you in much better stead than if you didn't do any at all. The good thing about the UCAT now, in particular, is that you do find your results out before applying. I think that's what it was like for me. So then it's not the end of the world if it didn't go as well as you hoped, because you can then tailor your application to the universities where they don't place as much weighting on the UK CAT. And I think that's quite important, to apply smartly and apply tactically for your whole application. So various unis have cut-offs for the UCAT, or they might look at personal statement more. So if you're particularly confident in that, then maybe those are more places that you'd rather apply to. And then some unis even have an interview calculator, so you can put in your grades and your UCAT score and see how likely it is that you could get an interview. So that's also a helpful tool. And then for the interview, so my main tip would just be to stay calm and just be yourself, which is easier said than done. But don't be thrown off by the interviewer. Sometimes they are told to keep quite a straight face and it can be a bit unnerving, but that isn't personal. But for me, actually, I didn't really have an experience of that. So hopefully you'll just get lots of friendly people and it will all be fine. It would be a good idea to have a think about your answer to the dreaded question, why do you want to do medicine? So it's good if you're able to come up with a unique spin on your answer where it is tailored to you. Instead of just saying that you like medicine or you like science and you like people, because I think these are things that everyone has in common who is applying to medicine. So if there's a way that you can make it about yourself, so try to use your experiences here and draw upon them, or if a particular topic interests you, then that would be a good time to talk about it as well. So for example, in my interview, I spoke about my interest in ethics and how I believe it underpins medical practice and stuff like that in that answer. But that is a question you will most definitely be asked in at least one of your interviews. So it would be a good idea to have a think about it before. It's also a good idea to have a look at some medical news and buzz topics before the interview, as you could be asked about them, or even if you're not directly asked, it's still a good thing to include in one of your answers. So, for example, I was asked my opinions on the doctors' strike, and also I was asked to discuss consent in relation to minors. So just things to think about now. Probably right now, I wouldn't be surprised if they asked about the ethical considerations of medical treatment during COVID times. That would probably very likely come up in an interview, so good thing to think about before. Something that I found useful is to look at the 4 principles of biomedical ethics before your interview. Those are autonomy, non-maleficence, beneficence, and justice. If you just give them a quick Google, they will all come up, all the long words and a bit about them each. And they're just handy to know. Buzzwords, if you just include them in your answers, they'll be listening out for them, which is good. Plus also, they're useful tools to help think through these ethical questions that you might come up in an interview. So yeah, those would also be a good quick read to have. And then my final tip for interview would sort of be to be university specific and look at the course that they offer. You could just be asked, why would you like to come here? And it's sort of helpful to refer to the structure of the course or the style of teaching, how they do anatomy or an intercalation degree or something. So that shows that you're actively interested in going to that specific university. So maybe just have a crib sheet of like something that you're looking forward to for that university or that you like for you, and you could discuss that if that question comes up. And then I think most of interview is mainly asking you to give an example of skills or experiences that you've had, so really reflect on those before as well. So I hope that was useful. Sorry I don't have too much to add about the experience of medicine, as I am still on my path, but yeah, I've really enjoyed medical school, and I'm sure best of luck to you all. And I'd be very happy, I'm not sure if I'm allowed, but to give my email or something if anyone wants to get in contact about applying to med school or Bristol specifically, if anyone would like any help. So I'm sure Mrs. Norton or someone could sort that out. But yeah, best of luck to everyone.
Thank you very much, Leah. That's wonderful. And yes, I'm sure you'll have lots of people wanting to get in touch with you. And I do remember actually you during your application year and the rhythms of the year. And it is a really difficult time, but I know some of you listening tonight aren't at that stage yet, and are just kind of listening to how you might get to that process. So yeah, there are lots of different really excellent bits of advice there in terms of preparation for particularly looking at interview, and that's something that I know that the senior sixth currently at the moment are working on. And just to say out there is the most amazing resource called the medicportal.com, and it basically it's just got everything together there that you could possibly need, especially in light of how they might be doing interviews this year given the pandemic situation. So that's enough of that for now. We can, as I say, have time for questions at the end, or indeed, if you want to be in touch with Leah, we can arrange that as well. So moving on through the trajectory and the pathway, I'm going to hand over in just a moment to Melissa, who, as I said, has now qualified as a doctor and is in, I think, her second foundation year of different medical experiences and hospital placements. So I'm going to hand over to Melissa without further ado. Thank you very much, Melissa.
Hello, is it okay? Hi everyone. Hi, I'm Melissa Weatherby. Thank you so much for having me here tonight. So I'm a junior doctor currently in my second year of training, working at Blackpool Victoria Hospital in general medicine currently. And tonight I'm just going to tell you a bit about my time at Man High, and then my career so far, a bit about my typical day in the life of a junior doctor, and a bit about the future. Is it okay if we go to the next slide? And the next one, and the one after that. All right, thank you. Okay, so I left Man High in 2013, and when I was at school, I did triple science for GCSE alongside maths and English, and I also did history and dance with French and Spanish as well. And then for A-level, I went on to do the 3 sciences with French. For me, I was quite split between languages or science because I always enjoyed quite a lot of different subjects at school. And I was also involved in quite a few extracurriculars. I've always liked music and played piano through school and took singing. And I've done ballet, tap and modern my whole life, so I was quite involved in dance as well, which I kept going alongside all my studies. And I think everyone as well can relate to the certain values that you take forward during Man High and afterwards, really. Things like resilience, being a good all-rounder. I think the school really encourages that. Dealing with pressure and stress, balancing lots of different things at the same time. And the school helps to instill a really good work ethic as well. It's also a really supportive environment. If we could go on to the next slide, please. And so these are just some pictures of my time at Man High. So I also did the Duke of Edinburgh Award as well, which I really recommend for everyone to do. It's a great talking point in your interviews as well. And can we go on to the next slide, please? So I'm just going to tell you a bit about why I chose medicine. So like I said, like at school, I always really enjoyed science, biology in particular. And one of the careers advisors told me that I should consider medicine, try to organise some work experience. So then I went ahead and organised some experience at Salford Royal and Manchester Royal Infirmary. And it was really during those weeks of work experience that it just made me realise that medicine was for me. I really enjoyed it. I loved following the team around on ward rounds. I went along to meetings, clinics, I got to ask questions, and I did some volunteering as well at Salford Royal on the renal ward. And it was really those experiences that really helped me to feel like this is where I see myself working in the future. So I would really encourage you all to try and organise as much work experience as possible to really see if this is a career that you can see yourself going into. To really get an idea for what the job is like. And if we could just go to the next slide, please. So Leah covered quite a lot of this already, but basically, yeah, the first thing I would say when you're thinking about applying is looking at the teaching styles for the different medical schools and thinking about which one would best suit you, whether you prefer more lecture-based, formal teaching, or a bit more of like group work or self-directed study, and then considering the admissions tests as well. And yeah, so one of the most important things I would say in the personal statement and the interview is about reflecting on what you've learned through all the different things that you're doing. So you're obviously all doing your studies. I know lots of you do many extracurriculars. And then hopefully you'll be able to get work experience, volunteering posts, and it's really explaining like what you've done, what you've learned from all of that, and reflecting on it, and you know why that's made you more inclined to pursue medicine, and sort of how it made you feel. Yeah, so there's just some things to consider before you're applying. And then on to the next slide, please. So when I was applying, I personally just wanted to sit the UK CAT. So I only looked at medical schools that did the UK CAT. And I wanted to leave home, but not go too far away. So I ended up going to Leicester Medical School, which I chose because it was an integrated course. So it's got elements of lectures, as well as seminars and group work where you like work through questions and cases. So for me that was the ideal course really, and we have a dissection suite, So for our anatomy sessions, we have real cadavers. So that was like really helpful in terms of anatomy. Whilst I was at medical school, so it's not all about just working hard for 5 years. I was also involved a lot in the Modern Dance Society, which was a great release outside of work and exams and things. But I was also involved in the Medics Welfare Society, which is helping to do like mentoring schemes for the younger students. And you'll find that there's many teaching opportunities to sort of help the younger students and like mock exams, revision sessions and what have you. So there's loads of societies to get involved in at uni, which is really important as well. All right, and the next slide, please. So then after leaving uni, I went on to Blackpool Victoria Hospital, because then I wanted to come back closer to home again. And I started off on paediatrics, which was a great first job. I would really recommend considering that for your F1 jobs, because it's really senior led. So I felt really supported the whole time, which was really important when it was literally my first job out of medical school. I wasn't really very confident because I didn't have any experience. So that was a great job to start off on. Then I went on to respiratory medicine, this was a really good job as well. Just to give you a general idea of adult medicine in general, because my ward was respiratory, but all my on-call shifts was covering the general medical wards. And then COVID obviously happened as well. And then it meant that I missed out on my third job. So I was meant to be moving on to a surgical placement, which was urology. But instead I had to stay on my respiratory job for 8 months. So it was a shame that I missed out on surgery, because now I won't get to do that job. But obviously there's nothing I could do about that at the time. But it meant that, I had really good experience on medicine for 8 months. I saw so many different patients. I had so many experiences. So it was a good experience overall, but obviously difficult working through COVID as well. And then now I'm in my second year. So my first placement was general practice, and I've now left that placement a month early because I've just been redeployed back to the hospital to help with the COVID situation. So now I'm on the geriatrics ward, which is care of the elderly, and I'll be on that for the next 4 months, and then finishing off with A&E as my last job. On the next slide is just my team when I was on respiratory, and generally, like in your team, you'll be led by the consultant, and then you'll have a registrar, and then your SHOs, and then you as a sort of junior. So there's normally quite a good team there to get support and help when you need it. And then obviously on the ward as well, you've got the nursing team, the HCAs and staff, who are all amazing as well. All right, and then on to the next slide, please. So I'll just give you an idea now about what I normally do in a day. So when I first arrive on the ward, I get a handover from the nurses first thing in the morning. Has there been any sick ones overnight? Who needs to be seen first? Is there any new patients on the ward who the consultant needs to see today? And then the consultant will arrive, and then we will do ward round and see all the patients. And a ward round is different as well, depending on different consultants. So on respiratory, I was allowed to see my own patients on ward round, but on geriatrics now, the consultant likes to lead the ward round, and we sort of go and accompany the consultant. So it's very different depending on which job you're on. But basically, then at around 11, we all have a big meeting where we discuss every patient on the ward, everyone's plan, what has to be done today, so we're all on the same page. And then for the rest of the day, it's just time to get on with the jobs. And that can be perhaps a patient needs a blood test today, they might need an x-ray or another scan doing. We might need to discuss them with a specialty, or they might be going home today, we might need to organise a discharge. And then through the day as well, deal with any sick ones who might suddenly become unwell, which happens quite a lot as well. You just don't know what's going to come on every day. And then on top of all that, you've got your on-call rota, which is when you're working mainly the unsociable hours, which will include your long days, your night shifts and weekends. So this is normally out of the normal 9 to 5 hours. So the main team is no longer there and you'll be making up the on-call team. So there's fewer members of staff there, which makes it a bit harder. And at this point, you're meant to be sort of called for unwell patients, important tasks, or like emergencies. But in reality, you'll get all sorts of calls that you'll have to deal with when you're on call. I've just included this montage here that I made during my first ever night shift as an F1 doctor. And it was, the first time I'd ever stayed up the whole night. And just throughout the night, you can see I just was so tired, feeling really sorry for myself by the end of it. Then I was so happy to be on my way back home. But honestly, like over time, the more you do, the more you'll get into the routine and help to establish your sleeping hours, eating habits and things like that. So I promise it does get easier over time. Could I have the next slide, please? So just some things that I've taken away so far. So when you first start as a junior doctor, you won't be experienced at first, and the team knows this. No one of you, and really the only way to become more confident is to just gain more experience. And over time, like the more patients you see and manage, the more confident you'll become. Like on my first night shift, I had a patient with a bleed out of the back passage, and I arrived and there was blood everywhere. The nurse was in an absolute panic. I was worried. I had to call the senior straight away. But now that I've been through that experience, I'll know like what we did then and like what I'd have to do next time. So I'd be like much more confident in that situation again. So really it just all comes with experience, and you will get there. And there's no silly questions. Honestly, the senior would rather you ask them for help when you need it rather than struggle on your own. And then it's also really important to reflect. This is really important throughout your career. And, when you've had a difficult event, an emergency situation, a difficult conversation with a relative, perhaps, it's important to think about, what happened, what did you learn from it, what might you do differently next time? And then resilience as well is important, just acknowledging with the nature of the job, you will have bad days and challenging times, especially during COVID as well. So then it's really important to reflect, and think about your experiences, but also to just switch off afterwards, and doing the things that you love and enjoy to help you de-stress. That's really important. And don't forget about what makes you you and what you do enjoy to do. Could I go to the next slide, please? So the future is quite uncertain currently. So for me, next year I was planning to take a year out of training and perhaps do some travelling or work abroad. But in terms of COVID, I just really don't know like what's happening there. So now I'm currently planning to apply for medical training and GP training, and just sort of see what happens, really. Yeah, but honestly, like, even, you know, throughout a crisis like this, you'll never be out of work, so at least that's something that you don't have to worry about. And then just finally onto the next slide. So I'm just going to finish with some take-home messages. So it's just really important, first of all, to really do your research and, you know, really think, is medicine for me? Because, you know, it is a difficult course, it's a challenging job. And if you don't enjoy it, you know, it's going to be impossible to try and get through it. So what I would say is really try and get some work experience and volunteering, talk to people as much as you can, ask your questions, and really try and establish, you know, a taste of the job and whether you think that this is something that you would like to pursue. And then, you know, if you do, then it is an amazing career. You know, it's not, there's so many specialties and routes to go down as well. There's really is something for everyone in medicine, like, you know, to suit every personality and interest. But yeah, it's not all about hard work as well. So do keep up all the things that I know all you girls do. You do an amazing job balancing all your studies alongside sports, music, everything. So really just keep going with that, working as hard as I know that you all are, and don't forget about what makes you unique. And yeah, so I'll finish there. We'll go to the last slide. Thank you for listening, everyone. Good luck to everyone. If you've already applied, or if you're thinking of applying. And yeah, feel free to get in touch if you have any questions, and best of luck to everyone. Thank you.
Excellent. Thank you so much, Melissa. I love the colourful cherries on your slides. It's making me feel very cheerful and looking forward to a holiday. Yay! Right. We have got questions coming in. I will deal with those at the end because I'll kind of group them together into different groupings, and then we can address some of them together. But what I would say before I introduce our next speaker is that there is available in the public domain something published by the Medical Schools Council, msc.council.com, just Medical Schools Council, and it's a glorious booklet which I give to all our current Senior 6 students before they're applying, and it lists all the requirements for every single medical school in terms of GCSE, UCAT, BMAT, how much work experience, all the sorts of things, and it's all in one lovely place, so it's very straightforward. And so that does give you a sense of something that Leah was mentioning a little bit at the beginning, is just looking at the individual universities and what they might want, because one university might really put great store in very high GCSE scores, whereas another university might say it has a minimum and that's it, and what it's more interested in is something else. And then the other thing just to say is that in terms of kind of, as Melissa was mentioning, experience and getting as much as you can, obviously it's quite difficult at the moment in our COVID times. But one thing I would say, particularly to younger students who are just starting on this journey, that actually what you need to build up initially is any kind of voluntary work that's in what I would call a caring environment. So at the moment, you can't really go into a care home or a library or an old people's home or anything like that because we're in lockdown. But some neighbourhoods and some communities have and organisations have transferred things to be online or telephone. There may be some age restrictions there, so you would need to check. But where if you're just doing something which is even once a week, you're making contact with a person regularly through an organisational group, then that starts to lead towards building up a bank of experience in those caring environments, which is so, so important. And the other thing is, for example, working in a charity shop, which some people that do D&V do as their skill or their experience, something that shows you're basically volunteering your time to something that needs empathy and communication and care. So that's a really good place to start, and it doesn't require any kind of medical experience or work experience opportunities at this point. Okay, So I'd now like to introduce our next speaker, Gazal Hodhodi, who is a specialty registrar in trauma and orthopedic surgery at the Royal Salford Hospital. So welcome, Gazal, and I will hand over to you. Thank you.
Thank you very much. Everyone can hear me? Yes? Hello, everyone. Thank you so much for inviting me to come and talk. Firstly, I'd like to thank all the staff at Man High for organising this. What a great event, and also well done for getting someone who is so technologically inept to actually somehow log in. So a great achievement overall. Okay, so first slide, please. So I'm going to give you a bit of a talk into, it's a slight deviation, I'd say, insight into surgery as opposed to medicine. I've now reached the point in my training where I've chosen the path that I want to go down, and that's surgical route as opposed to the medical route. It's something that's slightly more in the future for you guys. So I thought I'd just give you more of a flavour of what's to come. And luckily, Leah and Melissa have given you the actual useful information that you need to know. And this is more a kind of, this is your life of my life, which most of you are probably too young to remember. So I left in 2008, and I am currently, next slide, please, working at the Royal Bolton Hospital now. So every 6 months we move when we become registrars and trainees. So if you look at this first little picture that I've put up, and that's basically the medical school route up to when you become a consultant. In the green is where you are at med school, which is 4 to 6 years. And then right at the other end is becoming a consultant. So I've done my medical school years, which was 6 years. I did my 2 years of foundation. I've done my core training specialty years, and now I'm in the middle of my specialty years with a few more years to go before I become a consultant. So what do? Well, I'm a orthopedic registrar, and that basically means that I operate because I'm a surgeon, but it's all to do with the musculoskeletal system. So if you break something, if you have an injury, if you're older and you've got arthritis that needs to be treated, that's where my input comes in. Next slide, please. So my life at Manchester High, well, it all started in 2001. I don't even think most of you were born back then, so I'll kind of refresh your memories of what happened in 2001. Shrek 1 was released. Such hit songs as I Just Can't Get You Out of My Head by Kylie came out also. And I joined Man High, and that's a picture of me in the Year 7 hockey team. Miss Hannon was actually my form tutor at the time, and I mean, I feel quite sorry for her because I was late every single day for form and registration, I think. So I don't know how she put up with me. And the only thing I was really good at as a Year 7 student going through to GCSE was maths, science and PE. Next slide, please. So from there on, I realised that actually I'm better at the kind of logical subjects, less so at the arts, which begs the question as to why I picked Latin, probably to upset Miss Hannon and Miss Wellesby, who somehow managed to get me an A in the subject. So I did triple sciences, I did French, IT, maths and English that I somehow scraped through. Next slide, please. But unfortunately, well, or fortunately for me, my only concern really was playing hockey, sports, PE lessons. And this is a picture of Kelly Holmes when she came and opened the sports hall back in, must have been 2006 maybe. Honestly, one of the best days of my life, and I still remember it to this day. Anyway, moving on. Next slide, please. So the A-level years, I went a little bit rogue. I knew that I wanted to help people and work with people. I liked the sciences quite a lot, but I was also still obsessed with sport. So the choices that I had were to go into physiotherapy, maybe sports medicine. I wasn't really sure. So I did biology, chemistry, PE, which at the time was frowned upon. And that's a picture with Mrs. Newman and two of the other girls. And we were the first ever PE A-level class at the school. And I'm glad to hear it's still going strong. And I also did French and critical thinking, which were quite useful at the same time. Next slide, please. So this was the point when I had to think about where I wanted to go to university. I decided that medicine was for me, and through that I could continue with all my sporting activities, but also it was an excellent way to escape home. So the thoughts I had were, where was one of the furthest places away from Manchester? Well, St Andrews, obviously. It's a 7-hour drive. It was by the sea. It was a prestigious university, and probably one of the most important things for me was that it was still traditional teaching. So it was lecture-based, none of this PBL stuff, which, as I'm sure some of the other girls have already discussed, is good for some people. It's very self-directed learning, but I was the kind of girl that really loved being spoon-fed, and therefore St Andrews was ideal. The only thing I didn't really think about was the fact that it was only a 3-year course, and after 3 years in St Andrews, you have to move back down to Manchester or to stay in one of the Scottish universities. Another little story I have is that I was the first year to do the UK CAT as a pilot, and I didn't realise that you needed to take your passport. So I arrived, they told me I couldn't do the exam, and 2.5 hours later, my parents turned up with my passport, and I managed to get in 5 minutes before the deadline. So as you can imagine, I didn't do very well, but I got through anyway. So next slide, please. It's coming. I promise it's coming. There we go. So after my 3 years of pre-clinical in St Andrews, where it was all lecture-based and it was delightful, I came back to the University of Manchester for my clinical years. And I did 3 years at Withenshaw Hospital. So that's where all my education was based. I didn't have any lectures anywhere else. The only time that I went to the university was when I was doing my exams. And it was a great time. I really enjoyed it. And most of all, I enjoyed playing with the Manchester Medics hockey team, which is a little picture there. And this is kind of to prove that even though medical school is hard, you can still do other things at the same time. And that's actually a picture of when we won the national championships. And I was the first female captain that Manchester had ever had, or I think the whole of the UK had ever had in the medical championship. So it was a bit of a win for me. But after 3 years of Manchester, I just thought, I can't do this. I need to get out again. I was getting cabin fever. So I left. Next slide, please. And so I moved to Oxford, and that's where I spent 4 years of my life. Why did I go to Oxford? Probably because part of me always wondered what would have happened if I'd applied to Oxbridge. At the time when I was at school, it wasn't the right time for me, partly because it wasn't really the kind of place I wanted to be, but also I was the first year to do PE A-level, and people weren't sure if they would accept that or if they wouldn't. So I took my opportunity once I had graduated from Manchester. So I did my 2 foundation years there, and that's a picture of all my friends that I made in my very first job in Oxford, and we're all still great friends. Next slide, please. During my time there, that's when politics got involved for the first time that I could see in medicine, and that was during the junior doctor strikes, which is something that would probably be a good idea for you guys to read up on if you're nearing the interview stage. It was very interesting. There was no right or wrong answer to whether we should strike or if we shouldn't strike, and the reasons for why we were striking were different for each person. But that's a picture of me at Stoke Mandeville Hospital, and I don't know if any of you are doing GCSE or A-level PE, but you'll know that Stoke Mandeville Hospital was the first place where the Paralympics started in the whole of the world. So a little claim to fame. Next slide, please. And then came the third graduation, and by this point, I think my parents were a bit sick of buying new outfits, but never mind. So this was the MRCS graduation, and this is the membership to the Royal College of Surgeons. So once you finish med school and you do your 2 years of foundation, that's when you start to gauge whether you want to become a GP, whether you want to work in a hospital, and then when you're in the hospital, do you want to go down the medical line, so a physician, or if you want to be a surgeon? And depending on which one of those you pick, you then take postgraduate examinations. And from there, you either become a member of the Royal College of Surgeons, the Royal College of Physicians, or the Royal College of GPs. And there are several others depending on whether you want to do pediatrics, etc. But this was the first time I was doing exams outside of med school. So it was a bit of a shock to do them once I was working full time. And I've got to say, the key is to be as organised as possible. So next slide, please. So finally, after 4 years in Oxford, I thought, I can't really afford it down there anymore. It was lovely, but it's quite expensive. And I quite want to be close to home again, where I grew up, and I just love Manchester. So I came back to the Northwest, and the UK is split up into deaneries according to the medical schools and where your training is. So I'm part of the Northwest Deanery. That means that every 6 months I tend to change hospital. Because of the current COVID situation, I've been in Bolton now for about 10 months and will be staying there for another few months. I won't dwell on how COVID has been affecting our training, because it stopped my training for a bit, and it slowed things down and extended it most likely. But hopefully by the time that you chaps get there, it'll be an issue of the past, but we'll see. So in this picture, you can see me in the middle, teaching my juniors how to put plaster casts on, and one of my consultants is there and some of the other registrars. We've got a picture from the orthopedic ball, me operating during COVID, and me just generally making a mess whilst I'm trying to plaster anything. Why do I do orthopedics? I wanted something practical. I wanted something that meant I saw patients face to face, but also meant that I could learn new skills every day and operate. I'm still passionate about sports and injuries, and it was a way into that. And it's also an area that's never really got to stop, because people keep breaking things no matter what you do or say. And also an aging population means that people are going to become more frail, problems like arthritis are going to continue, and they'll need doctors that can treat them in that way. Next slide, please. So what do I do day to day? Again, this is going to be something that's way into the future for you guys, and maybe things will change by the time you get there. But on the whole, it's pretty similar for most surgeons. So during the week, I have several sessions where I'm in theatre. So I'm operating with the help of my consultant who's guiding me on what to do. I've got clinics, so they'll either be fracture clinics where I'm looking at people who had broken their bones during the week and come to A&E, or patients that are coming electively. So that means that they've got long-term problems that they want solutions to. I have a ward round that I do every day and once a week with my consultant. I do on-call shifts. That means that 8 to 8 I'm in the hospital seeing all the emergencies that come through, so acute fractures, and then 8 p.m. until 8 a.m. I'm still on call at home, sleeping and hoping that my juniors don't call me saying that there's been a major trauma come through. So what do I do if I'm not at work? Well, most of the time I'm probably at home reading about the next operation I'm doing, reading up on the knowledge that I learned at medical school that I shouldn't have forgotten. And then when I'm not reading, I'm reading some more. And once I've done some more reading, I'm probably watching a YouTube video trying to consolidate what I've been reading in the hope that it would go in. But the next day, I'll inevitably get asked a question that I don't know. So next slide, please. Do I have a real life? And that's probably what is the most important thing for you guys to think about for the future. It is debatable, but I'd say yes, I think I do have a bit of a life still. I still play club hockey, so I train once a week and I play every Saturday. I still spend plenty of time with my friends and my family. You have to be very organised about it, but you can make time for people. I go to the gym regularly, I exercise as much as I can, and I still love to travel. So though my path may have taken a slightly different route, especially through medical school, and even now I don't have as much spare time as some of my friends do, there is still the time to enjoy yourself as well. Next slide, please. So what are the things that you need to think about? Well, these are probably the things that I would say you should have thought about by now and going forward. Do I like to study? Because you're not going to stop. It doesn't matter whether you're 30, 40, 50. I think anyone who's in medicine will have to continuously study because more and more things come up as you go along. Am I happy to be a part of a massive institution? Unfortunately, the NHS isn't a one-man band, and you have to go with the flow often of what's going on with the NHS. Do I like teamwork? Do you enjoy being part of a team? You don't have to be a leader necessarily. You don't necessarily have to be a follower. Everyone finds their path in that team, but you need to enjoy and know how to work within a team. Are you happy to sacrifice a 9-to-5 life? You'll have to, because medical school is tough. You will have plenty of time to work and play, but it's just that it won't be 9 to 5, and that's something you need to accept. If you want loads of money, I'm afraid medicine probably isn't for you. It's a comfortable lifestyle. You certainly earn enough, but you don't become a millionaire by being a medic, I'm afraid. Do you like working with people? Do you enjoy helping people, seeing people face to face on a daily basis? Do you want to make a difference? If you want to make a difference to other people's lives, and sometimes be the unsung hero, the medicine is for you. You don't always get a clap or a tap on the back saying well done, but every day you come home and you think that you've achieved something good for someone. And do you like long-term goals? If you want to see kind of a quick fix on a daily basis, then maybe medicine's not for you. But medicine is very much long-term. You're constantly looking to the future and looking, at least until you become a consultant. And even then, I'm sure that Miss Davis will tell you there are more goals that you can try and achieve when you get there as well. Next slide, please. So that's all I've really got to say about what to look forward to in medicine once you become a registrar. So after your medical school years and your foundation years, it's not for everyone, but I urge you to find out as much information as you can before you do it. And for me, it's been an excellent job and I wouldn't change it for the world. And I love every single day at work, even during COVID. And hopefully I can see you all working with me as a doctor and not as a patient in the hospital. Thank you so much for your time.
Lovely, super. Thank you so much, Gazal. That was really, really fascinating. And I really love, and I know there was a method to this, Lex. I really love the way it's kind of going through the different sort of time stages of the journey. And what you were talking about there, Gazal, about the 9 to 5 and do you have a life sort of. I'm of an age, let's say I'm over 50, and I have quite a few friends who went down the medical route. And we always joke now, because they're also a similar age to me and I can see them again now, where we're not in COVID times, where I just basically didn't see them for 10 years. It was like they just kind of dropped off the radar. It was just around when like mobile phones and texting were things, so you'd get these odd texts. But basically they were always just doing, well, I don't know what they were doing, but I didn't see them. And then they kind of came out the other side and I have to say, they looked a little worse for wear, but then things kind of settled down a bit and they could forge their own path again and take back a little bit of control. But I say that half in jest, but I do know that it is, or my understanding is that it's incredibly tough in terms of the demands on you, what you have to do to get, to get ahead once you get your degree and once you've done your first 2 years of training. And then really, depending on where you want to go and what you want to do, it can be, incredibly tough, but obviously very, very rewarding. So thank you for that. I love all of those insights. And as I say, I've said before, and I'll just repeat again, we're going to hear from Miss Hannon at the end with regards to some of it, and I'll answer some of the questions people are asking about GCSEs and things like that. And also I will, if we have time, I will address some of those questions and certainly point you in the direction as to where you can get some answers to some of your questions. So do keep posting them if you have them. And so now I would like to introduce our final speaker of the evening, paediatric consultant Naomi Davis. So thank you very much, Naomi.
Thank you. Thank you very much. I knew this would happen. My cat has just chosen this moment to come into the room. So if you see this big ginger thing leaping across the place, my apologies. He'll probably start cleaning his bottom at some point. I hope everybody's woken up. So it's just occurred to me, guys, you were talking about this, but in fact, I think I've been a consultant longer than you've all been born, which is quite scary. And after this, I'm going to go somewhere into a corner and cry a little bit because, yeah, anyway, next slide, please. I've called this sort of crafting a career in medicine just because I think you're lucky to have this opportunity, because I don't think there's any chance I could have imagined where I am today and what I've done. And I think somebody called it a portfolio career, and it has certainly been that. It's interesting to hear everyone's passion, and I think that's absolutely what you need. Is you come through this, unless you have the drive and determination to keep going with what you're passionate about, the what's will grind you down. It is tough out there, and when I was told that medicine's really hard, no one can describe to you how hard medicine is. But if you keep that passion going, and if you've got that, then you'll get there, and there'll be surprises around a lot of corners. Next slide, please. This is not quite a black and white photograph. I think these are my indoor shoes. I was horrified that I was wearing brown shoes. I think they're my indoor shoes, and I was a complete goody two shoes, so, which is kind of, sorry to say shoes a lot in one sentence. So the fact that I was wearing these outside would probably make Miss Blake, wherever she is, horrified. But anyway, she was my headmistress. Nobody remembers her. Little blank looks on everybody's face. Miss Blake, who was she? Okay, that's fine. So you'll notice I have a really large trophy in my hands that was given to me by the school, and you're thinking, did she get this for medicine or for science or for something amazing like that? No, this was the needlework prize, ladies, and this is the only prize I got from school. but boy, has it stood me in good stead, because this is basically what I still do. Next slide, please. So I went to medical school. Obviously, I went to a medical school. This is a prospectus. That's the only colour picture on that prospectus. The rest of them are in black and white. I went to Nottingham. Why did I go to Nottingham? For reasons that people have said. It was integrated and intercalated, and it looked like it was a stately home, right? That's it. That's all I've got for you. Actually, the intercalation was really interesting because like you, I got an extra, Leah, I got an extra degree, and that means a lot further down the line. Nobody cares, apart from you, which medical school you went to be honest. People still to this day think I went to Manchester because I work in Manchester, and I didn't. But that it does make a difference having that extra degree. When you go through your jobs, you get scored on your CV or your application form on a point system, and having what I had, which was a Bachelor of Medical Sciences and then my BMBS, actually made a huge difference. I spent a lot of time at medical school, not at medical school. There were 72 exams in the first 2 years. I'm not very good at taking exams. I spent a lot of time after that with the University Air Squadron, which is my main memory of medical school. Next slide, please, very quickly, I think, because we won't go into that. So you take a lot of exams. On one side, you've seen me looking very formal, qualifying out of the medical school. On the left, for some reason, my husband-to-be decided that this is what a new fellow of the Royal College of Surgeons looks like, and I'm on the top of my beautiful BMW in a car park in the middle of Edinburgh somewhere that I would never go to again because it looks highly dodgy. It took me a huge amount of time to get these exams. The primary exam is all true-false papers. In general, women are bad at true-false papers. We go, well, you might be right, you might be wrong. So it took me a lot of time to get through that, past the clinical first time, because that's what we are. We're clinical people. We're not people that want to sit down and take exams, despite the fact that we have to do it all the time. Next slide, please. There is something, as you said, for every personality. So if you like people and you can remember complicated drug names, you should be a physician. If you like people and you're good with your hands, you should be a surgeon. If you like your people into suspended animation, consider anaesthetics. If you don't like people at all, go into pathology. If you like sitting in a dark room, be a radiologist. There really is something for everyone here. And even within each subspeciality, you can still craft your own career in there. So you can be an anaesthetist with an interest in pain or an interest in trauma. You can be an emergency medicine in a paediatric department or an adult department, or you can get in a helicopter every now and then. You know, there's some good stuff to do out there if that's where your passion lies. Can you move that on again? I think this is going to come through in bits and pieces. Sorry, Lex, if you just work through the next few clicks. So you'll undoubtedly be a doctor. And every now and then, when one of my surgical trainees is being a bit too, I want to lay steel, I will say, can I just see the doctor in you as well, please? Gaz's smiling quietly to herself. We use a lot of plaster of Paris. There's a certain sculptorish nature to what I do. We're scientists, and I spend a lot of time working through bits of paper as well. So I'm also an administrator. I'm certainly a leader. I spend a lot of my time leading all sorts of different teams, and there's a huge challenge in that. And when I've had an interesting career as a leader, I've worked my way up. So in terms of managing, I've managed my patient first. Then I've managed my practice, then I've managed my department, and then I was involved for some time in managing my hospital. That's an interesting route to go down. Never lose sight of your clinical work, because clinical managers are only there to tell the non-clinical managers why they're wrong. If anybody says that to anybody else, I'm going to be in deep trouble, but we're there to remind them that there's a patient in all of this. I teach as well. I teach medical students, I teach my trainees, I teach my colleagues sometimes, and they teach me. And most importantly, I'm a colleague, so I'm part of that bigger team. You know, to enable your colleagues to be able to do the job that they want to do, you just all have to be very nice to each other and very supportive. And that is undoubtedly what we spend a lot of time doing. Whenever there's something difficult, you will find various of your colleagues are up or down, are depressed and think there's no hope, or are completely optimistic and think that this is just one other good challenge, and when we get through this, we'll be on the other side. And you will go up and down like everybody else, and you need some good colleagues to keep you going through all of it. Next slide, please. So do what you love. I work with kids because I don't think they should be ill. I think it's unreasonable, and I like bones being put back into the right position. So I'm very figurative. So I like to make sure that things are pointing in the right direction. I also like small red-haired boys that are quite cheeky. That's me doing some teaching on the other side. So that's me saying, I do this. I want you to do this as well, because it validates what I do. So that's how I teach. A little bit, not really. Next slide, please. And I honestly have grasped every opportunity. So in the top left-hand corner, that elderly man I'm talking to is a chap called Dr. Ponsetti, and he was a very soft-spoken Spaniard working out of Iowa, which is a place I never thought I would visit, and least of all did I think it would be the most common place I would visit in the United States. But the man was a thoughtful genius, and he was over 90 then and still listening to some mad woman from Manchester trying to share her experience of how to manage children's club feet. If we can be like him, still listening to people after all that time, after thinking that you've perfected your technique, then you're going a long way. In the centre of the top line is another red-headed baby. There you go. Honestly, there's something about red hair. There's going to be a load of people out there with red hair going, you're being red-hairist. Actually, you respond to anaesthetics differently, so I'm going to stick with it. But also another couple of mentors of mine, and I have been blessed with some fabulous mentors in my time. I've also been invited far and wide to teach, and that has been interesting, frustrating. It's introduced me to parts of the world I never thought I would see. I've met people I still keep in touch with and people I never want to see again. The reason why the rhinoceros is in the middle of that is because of that old orthopedic joke. And if you ask us nicely, Gazal will tell you the old orthopedic joke about the difference between an orthopedic surgeon and a rhinoceros. Just at the bottom there, you'll notice I'm inside. Well, you won't know, but that's Russian language on the wall there. I spent some time in Siberia. Fascinating. Get me a drink. I'll tell you a story. And at the other side, that's when we were in Ethiopia, doing some teaching out there as well. Next slide, please. So I spent the first third of my consultant career developing care for children with club feet and how to get what I believed was the best care possible. The middle part of my consultancy as it stands so far, mindful that it might be the end of it, was developing the Children's Major Trauma Service. So major trauma was originally sent to, if you had a serious injury, you just went to the nearest hospital. Since 2012, you now go to a specialist hospital that requires people to know what they're doing at that specialist hospital, and it requires a network to get you there. It also requires that you do a lot of evidence-based practice. So we work with TARN, the Trauma Audit and Research Network. And then when you think you've got a whole load of kids and you've got too many kids coming in that are badly injured, you need to do something about prevention. So we've done some work on prevention as well. So suddenly my career is looking less classically clinical. It's certainly got a managerial point, and instead of dealing with just one patient in front of me, I'm looking at how to change the management of a whole cohort of patients, and how to bring people with me in that as well, in a way that when we make mistakes, people don't feel blamed, but they feel supported in learning the better way to do things. So that's been a really interesting time in my career. Coming out of this, we were called down as the clinical leaders. We were called to a meeting in Birmingham by the National Clinical Director for Major Trauma following the Paris attacks. And we were told to go home and make a plan in case we needed to respond in this country in a similar way. Next slide, please. And we did make a plan. Pierre Carli, after Paris, said this, and I think this places us in an interesting position. So I'll read it to you because, why not? The action of healthcare services is not limited to medical care. It is also a first step in resilience. I get a bit emotional at this, and you'll have to forgive me. I will recover very quickly, but I do. This still moves me by maintaining the quality in the organisation of care. Quality and organisation. So knowing if we're delivering good care and that it is organised appropriately, that despite surprise, violence and aggression, you oppose directly the objectives of terrorism. And you'll notice the date on the document to the side there. That was March 2017 that we ran our first Emergo exercise. So that is a tabletop exercise looking at how we would manage a mass casualty event. And that was in March of 2017. Next slide, please. And move on. In May of 2017, we started getting this call through, and you will all know that that was the date of the Manchester Arena attack. I wasn't on call that night, but I went in because some of the plans that we had made were in my head and not yet down and not yet signed off on a piece of paper. And we worked through the night and came blinking into the sunlight to realise that we were in the middle of a international news story. The next 2 or 3 weeks were hard work indeed, but I saw the NHS at its best. I saw people really understanding why they did the job that they did, and feeling that they were helping people again. And all those irritating things that we meet every day went out of the window, and we were utterly focused on patient care. And I met 2 very interesting women, one wearing an orange hat whom you will recognise and I recognised, and one I had never even heard of that certainly put the smile back on our patients' faces. And at least I know her name now. Next slide, please. Following on from this, we've been doing some work around children's rehabilitation, and this takes me a little bit out of surgery and more into the medical side of things, in that we can put children back together again and make their x-rays look good, but there's so much more to getting them back to, sorry, can you go back one slide please? There's so much more to going back, getting them back to where they need to be, which is essentially in school, because your job is to be in school. There's a lot of things that happen after a major trauma. The young lady with the horrible big bump on her head remains a personal friend of mine, but she came in one night actually before the trauma service, and through her story of really quite profound injury, she has informed not just our trauma service but our rehabilitation service, and I've done it with great partners from Greater Manchester Health and Social Care and the Defence Medical Services, who came in after the Arena attack as well and supported us through looking after our victims from blast injury. Next slide, please. Now, I was interested to see that Leah had a plan of her working week. This is mine. My husband saw this the other day and said it just gave him a tachycardia just looking at it. But this is what my working week looks like now. So last week I had an all-day list on the Monday. I always go into my operating lists expecting the unexpected, and my lovely teams always come up with some new problem that I hadn't thought of and planned for that makes the day more interesting. But you'll see that in the middle of that, I'm trying to get into some trauma meetings as well, and indeed our rehab meeting and our consultant meeting was after hours in the evening. We have a baby hip clinic on Tuesday. We do that as a team. It was my turn to do it. We take it in turns as a consultant. The governance around that is superb. It works really well. We have standard ways of treating children with hip problems, babies with hip problems, and that's great. In the middle of that, I've got some mentorship to do for one of our trainees. So I am an academic advisor for one of the other orthopedic trainees, and I also have a group of medical students that I'm academic advisor for as well, and you all give me hope. It's fantastic. I love to see you coming through because you're going to be looking after me when I'm ill. and older, not much. Our spina bifida clinic is an MDT clinic, so I get together with neurosurgeons, urology surgeons, psychologists, and who else is there? Some specialist nurses to try and deal with children with spina bifida holistically. There's a buzzword for us, and that's just started. So coming out of COVID, we noticed some free rooms in the clinics, and we nabbed them for the joint clinic they've been wanting to start for ages. My clubfoot clinic is on a Wednesday. It's all day on Wednesday, and you'll see that in the evening I was doing a consensus meeting around again clubfoot management. That was a national meeting. Then we had the pre-meet for this, which went superbly well, and then I had my piano lesson because I'm still learning. I'm struggling through grade 5 at the moment, if anybody's interested, but we never had a piano at home when I was at Manchester High, so I didn't have piano lessons then, or they didn't continue very long, and I've been able to start that again now. So never say never. There you go. On Thursday is my admin day normally, so now instead of sitting at my desk at work, I'm sitting at my desk at home with my cat in the background, who is now famous. He's called Achilles. It's a clubfoot thing, and you can see that I've got various meetings. I've snuck something secretive in that I'm not going to tell you about. I'm meeting people from other hospitals to help support their service. Susie wanted advice on how to survive in a leadership role, and I managed to come up with something halfway sensible to say. And then our journal club was in the evening. And then on the Friday, I've got a PhD, well, a student who's just passed her PhD, so I mentor her, and she produces papers with my name on it, which makes me look really good in the research area. And then I've got some national meetings, and the last thing on Friday was an utter joy of one of the nicest teams I work with, making some plans to get children back to physical activity after injury. And Gaz, I think we could probably involve you in that, so put your hand up if you're interested. Next slide, please. Lovely. And this is just to show you why this is the best job in the world. So the young lady on the horse was the young lady with the bump on her head that got back on a horse after she'd fallen off it rather dramatically, and has now just completed her MSc in anatomy up in Edinburgh. But it's really about the kids, and when management or other jobs or the admin jobs grind me down, going into the clinical space is one that always re-energizes me, and it's all about them, and it's about the teams in which we work. We got horribly told off for putting Spider-Man legs on that child's plasters, but he loved them, no matter what anybody else thought. And if you just quickly, one more quick click, just through that, yeah, so I got another prize, and you can just get rid of it now. There are some unexpected things, just click again and it'll go. Thank you. There are some unexpected things in life, and if you grasp every opportunity, there is no end to what you can achieve for your patients and for yourself. And I've stopped talking now.
Right, brilliant. Gosh, thank you so much. There was so much in there. That was a real whistle-stop tour through you know, the heart of your career, which just sounds absolutely fascinating. And I'm afraid somebody's going to have to tell us that rhino joke, because we can't just leave that hanging. So I don't know whether you want to do it now, or whether Gaz knows that joke and can tell it later, or doing the Q&A. I'll leave you to ponder that. Feel free to just wave if you think, right, I'm going to tell the joke. So so much in there, and just the idea of just all that travel and those different roles. I love the different roles that in your professional career that you have, that, you know, go from being what we would imagine to being a clinical specialist to being a colleague and a teacher and everything in between. Really, really fantastic. And I think, again, it's shown that trajectory, that where you can really get to, and you have a lot of choice, actually, I guess, over where you go. You're kind of blown a little bit by the winds of opportunity and experience that's presented, but then you grab those opportunities and decide to go with them to Russia, to Ethiopia, to Iowa, clearly a lot. So that's so brilliant. Thank you so much. Your cat has been very well behaved as well, so that's great. My cat, I'm not at home at the moment, my cat is always climbing all over me if I do anything at home, so That's brilliant. So thank you so much. We've now heard from all of our 4 guest speakers, and I'm now going to hand over to Miss Hannon, who is our head of careers, and then she's going to do a little bit about kind of routes in and how you get to start this journey of becoming a medical specialist. So I shall now mute myself and hand over to Miss Hannon. Thank you.
Okay, the problem with coming last is that, of course, everyone has said everything basically that you plan to say. But before I start, I just want to say to Gazal that I have very fond memories of you, despite you always were late. You always arrived with a load of hockey kit and cluttered the classroom. I think I usually fell over your PE kit at least once a day. But yeah, very fond memories. 7G, weren't you? 7G? Yeah. Okay, so I think pretty much everything has been said, but I'm going to whiz through my points quite quickly and just emphasize a few points that particularly Leah and Melissa said earlier on. Lex, could you put the first slide up? Okay, so this is aimed really more at those of you who are in year 10 and 11 rather than sixth form. And then I'll move on to some things which are kind of, well, hopefully useful for all of you. So the first thing is, this has been mentioned already, check the entry requirements, because I think you'll be surprised by how much they actually vary. There's quite a lot of variation there. My feeling is, from having kind of managed quite a lot of medicine applications over the years, is that if you take biology and chemistry, that leaves you with the kind of the biggest, the widest kind of range of medical schools that you can actually apply for. But it is possible if you have a different combination, if you've got, you know, chemistry and physics or you know, a different combination. You don't need maths and you don't need a third science unless you want to apply for Cambridge, which does prefer 3 sciences because they're fussy like that. I'm going to echo what a few people have said. So Leah talked about studying RS. I know that the new A-level doesn't cover medical ethics anymore, which is a shame, but it does cover ethics and ethical issues generally. So that's something you might like to consider. I think, Melissa, you said you've studied history, or was it French or Spanish? Or one of those, I think. And Gazal took PE because that was very much her passion. And I think, you know, if there's something you're really passionate about, you know, a language or a humanities subject or a creative subject or anything else really, don't be afraid to take it. It will keep a different kind of set of skills going, and it will be really helpful to have something different along with your, you know, your biology and chemistry. I always think, especially for the UCAT, where people often struggle is with the verbal reasoning section. That's often where we find people tend to get the lowest of their marks. And I think if you do have, you know, a humanities subject or something different, it will keep different skills going for you. And of course, for the BMAT, you have to write an essay. It will also help your interview if you've got a subject which has been more essay-based or writing-based or more discussion-based maybe than a pure science. So just some things to think about for those of you who are in year 10 and year 11 now. Can I have the next slide, Lex, please? Okay, so we've heard quite a lot about work experience, and at the moment this is problematic. I mean, it's going to be, isn't it? We're in the middle of a global pandemic. Things are not as they normally are, and it can be quite challenging normally. Again, time's on your side. So those of you who are in year 10, year 11, even junior 6, hopefully things will be back to normal at some point in the next, I don't even want to say it actually, but plan ahead. You do have time. The summer after junior 6 is really the last big opportunity to get some work experience in before you actually do your UCAS application. And going back to what's already been said, do make sure that you don't, I mean, it's great to get lots of work experience if you can, but you want to avoid coming to write your personal statement and just listing what you've done. You don't want a mechanical list. And the universities want to know, you know, they want you to be reflective, and they want to know what you've learned from your work experience, you know, what you felt about it, what you thought about it, what surprised you, all those kind of points. So what I always say is, and no one ever does it, but I always say it, is, you know, keep a diary, keep a log, because so many people come to see me for help with their personal statements, and they've done loads of really good work experience, but when it comes to writing about it, they actually can't remember anything. They can't remember any details, and you have to drag it out of them. So if you can face it, keep a log of things you've seen, conversations you've had, things that provoked your curiosity and made you want to go and find out more about something you've witnessed. Don't dismiss volunteering. Obviously, it's important to have something in a healthcare setting, but volunteering is great as well. Anything that, like Mrs. Norton said, has a kind of caring aspect to it. And it always puzzles me that people don't try and get some work experience with physiotherapists who do so, you know, they see so many different kinds of patients and clients, and they have such breadth to their work. And it's far easier to get into a physiotherapy practice than it is to get into a hospital or a GP surgery. And physiotherapists are just amazing. So, you know, be a bit more flexible in your thinking. Don't fixate on having to get into hospitals, because it's not always easy. Some placements have now gone online, and I know some students who are doing online work experience placements, which is great as well. It's not going to replace the traditional work experience placement, but it's certainly better than nothing for the moment, and everyone's in the same boat. Can I have my next slide, please, Lex? And for my last point, and again, we've heard this already, read the news, especially at the moment. For those of you who are going to be having interviews in the next 4 or 5 months, and I know I've talked to the Senior Six about this, you're surely going to be asked about ethical scenarios that are somehow connected to COVID. You know, you're going to be asked about issues to do with public health, vaccination, anti-vaxxers. You know, why are 40% of Americans apparently saying that they're not going to take a vaccination when it becomes available? You know, these are all issues that are in the news all the time. So go on the BBC website, go on the health section. I'm always on it. There's loads on there. It's really interesting. And read up about the NHS. I was at a talk about a year ago with an admissions tutor from Imperial London who interviews for medicine, and she said she was shocked at how many people came to interview and didn't really understand what the NHS was and how it was different from healthcare in other countries. So make sure you know those things. Those are really important, obviously. And, you know, other stuff's difficult at the moment, so getting out to do work experience is difficult, but there's still things you can do. So I know that the RS department still run ethics events. Take those opportunities in school to discuss and debate issues that are related, you know, related to science and related to medical ethics and so on. Or volunteer to give a talk, do some research, look at a MOOC or something that's related to medicine. There's plenty that you can be doing now. If you're in year 11 now, you might want to consider doing an EPQ that's related to medicine or some aspects of healthcare next year. So I think that's all I wanted to say, and we're now moving on to questions. So I think I'll hand back to Mrs. Norton. Shall I mute myself?
Hello. Hello, thank you very much. Yes, that's really useful. Just some general pointers for things that you can do now if you're not in the process of actually applying. If you're senior sixth and you're in the process of actually applying, then you know these things. And if you're in year 12, junior sixth, we're going to start talking about careers and things that you need to start doing to prepare yourself if you're wanting to apply for medicine. So we've got a few questions that are around GCSEs and what if my GCSEs aren't as strong as I perhaps want them to be, or are there other things that are taken into account? And I suppose what I might do is just, if I could maybe turn to Leah, because Leah, you're the most recent student from school, and to be honest, I don't remember what your GCSEs and your A-levels were. I'm sure they were very, very good. But I wonder if you have any thoughts that you can give, having recently gone through the process, about other things that you know were clearly relevant at Bristol, but that the other universities you applied for and universities that your friends applied for, or maybe some of your co-students at the moment, that they did to perhaps boost their profile, but weren't just about having, you know, all 8s and 9s at GCSE. So I'm going to hand over to Leah now, if that's possible.
Hi. For GCSEs, I guess, as has been said before, every university weights what they look at a bit differently. So they can take into consideration lots of things: GCSEs, predicted grades, your extracurriculars, your experiences, UK CAT, BMAT, etc., etc., etc. So there's lots there, and I really think it's important when you're applying to tactically look at the universities and see from your resume what you have and then what the universities are looking for, because sometimes you can apply and you can just be cut off straight away if they have a certain cut off for the UK CAT grade or the GCSEs. So it kind of is a waste of an application in that way. But other universities might be better suited for that. So some universities don't weight GCSEs as much in their calculations. I think some don't even look at them all together. I'm not sure off the top of my head, but there will be a way to look that up. Equally, I think some universities don't even interview, but most do, and some weight more on the personal statement than they do on the UK CAT. So again, if you don't do as well in that as you thought, then maybe have one that has more of an emphasis on personal statement and interview. In terms of boosting your application, as said before, any volunteering or work experience you can get is great. I know it's really hard at the moment to get it, but as mentioned, lots of things have moved online, and get creative with what kind of experiences you can have that can be useful. Like one of my friends, he did work experience in an undertaker's. He couldn't get a hospital placement, so he went there and he learned about breaking bad news, talking to families, and learn more from that side of things. And it's lots of useful skills there. So see what experiences you can get. And then I guess any other qualifications you can have also boost it, and just any way that you can seem interested in the profession. But aside from that, also just extracurriculars. Like I remember talking about, I did lots of shows at school. I remember at interview and in my personal statement talking a lot about teamwork in plays and how that can relate to teamwork in medicine and various things like that. So there are ways to spin what you do have into a way that can demonstrate your skills and how that they would relate to the medical career. Hope that was helpful.
Yeah, that was really helpful, thank you. And as I mentioned before, there is actually a booklet published that explains all the nuts and bolts of the entry requirements. So what Leah said about being strategic about your application, when it comes down to it, you look at your profile and you only need one offer at the end of the day. You have 4 choices on your UCAS form for medical places. You only need one offer in order to get a place. So you need to be really, really strategic. And somebody mentioned about it doesn't really matter what medical school you go to in the end. Your experience matters. You need to enjoy it, you need to learn from it. It's about your style of learning. But ultimately, nobody cares really on your CV which medical school you went to. So you've got to choose one that strategically, if you're concerned about your profile, is going to fit your profile. And we can talk about that more when we kind of come to the advising part of it at school. But there are some very basic facts out there that you can simply find out. And if the cutoff is that you need these grades in your GCSEs and you haven't got them, then look for a university that doesn't ask for that. There's a question I'm just going to tackle myself straight away because it's there about doing 2 languages possibly at A-level. I think, and there are a couple of other things about A-level choices. What Ms. Hannon has said is about, yes, you need to have 2 science A-levels, and again in the entry requirements you'll be able to find out what those are. Typically it is biology and chemistry, but now we've moved away from that and some require only chemistry and not biology. There are a few now that say biology and another science and not chemistry. So again, you look at that and you make a decision about what else you want to do that's of interest to you, that you can succeed at, that's going to satisfy some other aspect of your love of learning and your skill set. What I would say is that 2 languages is probably a lot unless you're going to do 4 A-levels because you need to do 2 sciences as well. So it sounds to me, by the way, whoever that is, that you probably want to do languages at university. But it's not impossible, and you certainly can do that, but we can talk about those kind of nuts and bolts as choices when we get to the advising. I've actually had a question about gap years, and I know that Lex wants me to name who the person is going to be, who's going to answer this question, but if any one of you has got a real strength in or an idea about whether it's a good idea to take a gap year or not, if you wave at me now, I'll say your name and then talk for a bit so that Lex can have some time to set it up. I mean, I don't know if anybody, did any of you take a gap year? Maybe one of our speakers, none of our speakers took a gap year. So I'm not sure that anyone would have particular thoughts about that. I wonder if Ms. Hannon might have any thoughts about taking a gap year in medicine. So possibly if we can hand over to Ms. Hannon, who is now live. Excellent. I will mute myself.
Yeah. Yes, because I handle the reapplicants who are often applying for medicine, they are by their very nature taking a gap year, even though they hadn't actually intended or planned to take a gap year. They end up taking one, and I think it can be a really positive thing, because you can use it to do paid work. I know someone who's doing a kind of internship. That's actually dentistry, but it's a similar principle for medicine. Some people use it to get more work experience, or I've known people who got a job as a carer. I know someone who got a job in a call centre actually, and all these things are giving you more experience. So I think it can be a really positive thing. It also means that you're not trying to do stuff like preparing for the UCAT and preparing for interviews at the same time as doing 3 A-levels. So they have a little bit more time to do all that really. And it is time consuming doing loads and loads of practice, UCAT papers and so on. So I think it can be a really positive thing, but obviously it depends on what you do with it. You want to have some kind of plan that you can mention in your application. So I think my answer is a qualified yes, it can be a good thing. Does that answer the question sufficiently? Depending on what you do.
Great, super, thank you. Yes, I think a gap year, again, it's optional. It depends on what you're going to do with it. Sometimes it might be a forced gap year. I do sometimes say to people that applying for medicine can be a 2-year application cycle because it's very competitive, and that's kind of part of the course, and you shouldn't see that as detrimental. And it might be that you want to do something completely different in a gap year and go traveling or something like that. As long as you can stay in touch and connected with what it is you're applying for in the end, which is medicine, and have something related to that, and keep your if you do the traveling thing, you need to keep your hand in it a little bit so that you don't lose all that kind of knowledge and experience that you have. Okay, brilliant. We've actually now we've had a question about we've heard from everybody different stages of the journey, and that it takes actually a long time, and you need a lot of stamina, and you've talked about the commitment that you need to have, and the diversity and the things and the exams that you have to do. And has there ever been a time where you've just thought, actually this is too hard, this is too much, this is kind of putting me off? And I think I'd like to ask every one of you that question, because it must be there kind of in your heart somewhere, the moment where you're like, oh, I'm not sure about this. So I'm actually going to start in the order that we had our speakers in to start with. So I'm going to start with Leah, who may not have had that moment yet because you're still in medical school, but you may well. So Leah, if we can hand over to you, and if you can just talk about whether you've had that moment of, oh, this is too hard, I'm not sure I can do this.
Yeah, definitely. I've definitely had that moment quite a lot, and exam stress getting on top of you, like a hard day, like it does come a lot. But I think the pros for me have definitely outweighed the cons. I like you have a hard day, and then the next day you'll go in and you'll have an amazing day and come out feeling amazing from it, and it reminds you exactly why you're doing this process. But the thoughts there of, yes, I've got however many years ahead of me, and I've got so many hundreds of exams ahead of me, is constantly there. But I find the work very rewarding and what I'm learning very enjoyable. So, and I'm hoping that will continue.
Melissa, yeah.
So yeah, I've definitely experienced that as well. During uni, I failed one of my exams in 3rd year. I remember I'd never failed anything before. It was an awful time for me. I couldn't believe it. And then at that point, I considered maybe I'm not good enough. I should just walk away. Do I want to do this anymore? And that was a really difficult time for me. I did actually consider pursuing another course instead. But then in the end, I went back and reset the exam and passed. And then sort of getting through that milestone really then made me think, this is what I want to do. And I was just so determined then to just get to the end of the degree. And I carried on, and I passed everything else. And then I enjoyed the course, I think, so much more because I really had a renewed drive just to get to the end of it. And then, yeah, starting work, I've had some bad shifts and times with a really sick patient. Sometimes you do everything you can and the patient just doesn't make it, and it wasn't your fault, it wasn't the team's fault. We did everything, but it's just what happens. And so there is some really challenging days, but I've been so lucky to have such an amazing team who were always there for each other and sort of help you get through it. And overall, I've had such a rewarding experience so far in my career. And so many times where we have helped people, we have made such a difference, and in the end, for me, that does outweigh all the bad days. And yeah, I think it's just about accepting that there will be bad days, and I think you will have these thoughts. It could be many times on many occasions, but at the end of the day, if you do enjoy it and it is rewarding, then you can just sort of get through it and just accept that is part of the job.
Okay, my turn. I would probably say that the last time I had one of those moments was earlier today when I was in clinic speaking to my consultant, and then I suddenly realised I have about 4 incomplete research projects to do. I've got an appraisal coming up. I haven't read my basic sciences textbook this week. And, sometimes it becomes overwhelming. It's something that they teach us in medical school and going through your training is the concept of resilience. And that's basically the idea of being able to put up with the stressful times in your life and know how to deal with it. The advice that I would give to you now is to come up with strategies to deal with stress now. When the times are good. So when you're having a really good time, think about what's helping you to have that good time. What is it that's making life enjoyable for you? So that when you do have those difficult times, you can flip back to that and say, okay, what was I doing then at the time? What helped me? Whether it's family support, it's sports, it's music, it's just talking to friends, because it happens. But you have to remember that the human race has a lot of power, and you can do anything you put your mind to it if you want to, and if you're still passionate about it. And if it's something you really want to do, you'll get through it. Just make sure that you build up that mental strength and that resilience, and you'll be absolutely fine.
Great. It's lovely being left to the end to do this. What they said, they're all right. I can't reassure you that this goes away. Okay, there are still times when I think that the hardest thing I do in the day is walk in through the front door. Okay. But it's also the best thing I do every day. And I think what you're getting from us is that overwhelming passion for what we do that gets us through some hard times. but everybody has hard times. You know, this is life. You know, who can say from anywhere that nothing hard ever happened in their lives? Overcoming it and learning from yourself as you do that while helping other people is what we get from medicine. And I think what you've heard from us is that we all think that this is worth it, and that we're prepared to give that extra bit. And you've heard that there's been on a personal level, that I've had a personal cost to be able to get through some of the things I've got through. But that personal triumph as well is extraordinary. And I get a hug every day off my patients. It is the best job in the world, and it's worth all of that. That's it.
What a lovely way to conclude that series of questions. Fantastic. Thank you all so much for that contribution just then, but also for your contributions throughout the evening, throughout this event. I think that we've done many and several insight intos in lots of different fields, and this is actually the first time we've done medicine, and I think it's been really, really eye-opening and revealing, and for me and probably for Miss Hannon as well, who do kind of careers advising and helping students, just to hear from different medical professionals at different stages of your career with very different experiences, but all man high girls, which is wonderful. And also to hear in the end that it's about making the best of your strengths, so in response to these questions about GCSEs and things like that, but also that you're passionate, and if you absolutely love doing this and are absolutely passionate about doing it and determined and wants to do it, that you will do it, good, bad, everything in between. So that's a really, really lovely way to end. I would like to thank all of you again for coming and attending for this evening, our speakers, from your very busy schedules. And also for all the students out there, and possibly if there are any parents listening as well, thank you very much for your attending as well, attending this event tonight. I'd like to thank Lex and also Mr. Hayes for his fantastic IT work. And you'll see on the screen there, if there are any questions that weren't answered, if you email development there on the address on the screen, we can answer them for you. And also, if you would like to get in touch with, I know that Melissa put her email address up there. So Melissa, I presume you can just give me a wave that you're happy for people to contact you because you put your email. Yeah, she's giving us a wave. And Leah also mentioned that she would as well. So we can put you in touch with Leah. And I'd finally just like to say that we are so grateful for our alumni for everything that they do. I mean, we genuinely appreciate all of your time. And that we do other of these events. And for the audience out there, we have another insight into coming up in December. So please look out for that one. It's on a very different area to medicine. But one of the purposes of these is that you come along to these and you hear about different things. So you may not be 100% committed to medicine. You may simply have come because you're interested to hear about it. And you may think, possibly not for me. I'd like to hear about some of the other things, the charity sector, law, things that are coming up in the future. So keep your eyes, students, on the Insight Into programme. And finally, I would like to close for the evening, say thank you once again for attending, and we look forward to seeing you at a future event. Thank you so much. Good night, everybody.